Well, good afternoon. My name is Stephen Hrustich. I am the project manager for Vision 2020, and I'd like to welcome everybody to Vision 2020's Model Performance in Community Risk Reduction Symposium 6 recap webinar. Today's event, we approximately have about 240 people signed up for the event. We're excited to show you the recap and the highlights from this year's event that was held in Murfreesboro, Tennessee. So before I start there, this webinar is brought to you by DHS FEMA's Assistance to Firefighters, Fire Prevention is Safety Grants, as well as the United States Fire Administration's Fire is Everyone's Fight. We have a great lineup in store for you today with 5 presenters as panelists to provide a short summary of their presentations that were held at Symposium 6. We like to call it S6. So before we start, I'd like to also say you can utilize the Q&A feature in Zoom webinars. If you look at the bottom of your screen, there's a button to ask questions, and we'll be taking those questions at the end of the presentation. So at any time, you can just ask your question and we can line them up to get answered at the end. So I'd like to start with a little bit of history on the symposium. The inaugural event was held in 2010 in Virginia. This is held every 2 years, and it is really showcases the best peer-reviewed CRR programs in the nation. Symposium 6 was held in February of 2020 in beautiful Murfreesboro, Tennessee, at the Embassy Suites. It was an incredible venue. We've got rave reviews from all the attendees as to the venue itself, as well as the breakout rooms and presentation area, general session area, and the vendor exhibits. We had representation from all 50 states, selected a delegate from each state, as well as the U.S. districts and territories. And we also had international representation at the symposium itself. So this event here came off the heels of our inaugural international symposium I just wanted to mention, held last September in 2019 in Birmingham, UK. That was attended from folks from the United States, from Canada, from the UK and surrounding European countries. As far away, we had people from Australia. So we look forward to that event this coming year in 2021, which will be held in Surrey, British Columbia. So before we get started, I would like to just say a sincere thank you to all our partners. Specifically, I'd like to name out a couple of these people: Murfreesboro Fire Chief Mark Folks and his Assistant Chief Carl Pease for their use of their honor guard to open up the event, as well as provide volunteers and logistics for us, specifically for shipping items to Murfreesboro and holding on to them before the event. So we thank them for their kind support there. We'd also like to thank the Tennessee State Fire Marshal's Office and the Tennessee State Fire Inspectors Association, really for logistics on the ground at the event and assistance with audio and visual. They were truly great partners to provide a lot of support for us at the event. With Symposium 6 Planning Committee this year, we used a totally different model than we had used in the past. We looked at that collaborative approach, and we were bound by a very tight time frame. And I can say these folks did an incredible job. We had representatives from Vision 2020, from the IFC, the NFPA, IFSTA, the ICC, and many more. And I just wanted to personally say thank you to those folks for lending their efforts in the peer review process, the planning and development for for the presentations, and how smoothly everything went was a testament to the work these folks did. So I certainly owe them a big round of applause from everybody, and I could hear you clapping in the background there. Lastly, I'd like to say thank you to Assistance of Firefighters Grant, Fire Prevention and Safety Grants, which really provided funding for the symposium that is really geared towards support of those 50 state delegates that come in, learn about these programs, and the goal there is to help them take this information back to their particular states and help move it forward from there. So one thing that we utilized was Slido at Symposium 6. First time we had used it. We've really embraced this tool for audience engagement. It is an incredible way for us to sort of move the needle when it comes to bringing the audience to life and making them part of the event. Typically, we ask people to put their phones down so that they can pay attention. In this case, we don't. We ask them to grab their mobile device, utilize Slido to join the session here, and it gives them the opportunity to provide feedback, to polling questions, as well as ask questions of the presenters themselves. It's really the best crowdsourcing tool out there, and it provides for a much more effective learning experience. When we look at the typical symposium, we would get 3 to 4 questions by passing a microphone around the audience, which was time consuming. Some people wouldn't use it. We couldn't really hear them. The difference between that 3 to 4 and what we received this year was 30 to 50 questions for each of these presentations. So it gives people the ability to sort of like or vote up a question that they may have. It prevents people from asking similar questions when they can see what questions are in the queue in the pool, and it really delivers. This is broadcast live on the screens there at the general session area, so we could see immediately what was going on with these polling questions that we would ask. So what we want to do is go and take a look at a couple of those polling questions that we did ask. And the first was this word cloud. In one word, what is your greatest challenge to reaching your goals in regard to community risk reduction? So what we can see here, there was some interesting changes that came out over the years. Many times for past couple symposiums, we saw data. We need to have more information. We need to understand our data better, or our data is terrible. That, as we can see with this, it is one of the higher items that arose. But time and staffing, resources were really critical components of this piece. If we look at some of these, with they can probably be combined when we talk about budget and resources or funding. They're pretty much talking about the same thing, money. So when we take this, it all comes out, I think, and brings a better picture of the struggles that the fire service is going through in regard to community risk reduction. I can tell you this right now, that what we see with the COVID-19 pandemic, this would change, probably look much different today than it did even 6 or 9 months ago. So there's a lot of information to be gleaned from this. We utilize this as a way to focus our efforts and energies to identify those gaps and challenges. And that's a critical part of the process in how Vision 2020 develops its strategies to provide training, tools, and some of the focus moving forward. So we listen to you. I want you to know that it's important that everybody understands this information comes back to a group of people that really take heart in making this move forward in a big way. Again, this is a multiple choice poll that we have, and there's a couple things here that we see up in the corner here. We can see 223 people responded to this. This would be something that would take us a month to do if we ask this question, through a different polling mechanism. While we have all these folks in the room, we know we are getting a great sort of cross section of the fire service and how they feel. We collect demographic information. I'm not showing that here on the screen, but who are you? Answer this question. Where do you come from? What's your organizational type? Are you from a large organization, smaller organization, volunteer, career, metro? So all those play into, the pieces of examining, analyzing this data to better understand it. But this one here specifically looks at community risk assessment document and how many people have a completed document. Here we see 30%. We understand that number. That may be a little high, just depending on the number of people we had in the room and where they were from. If I ask this more on a national scale, I would expect that figure to be about half that, or even less. So, but it also has some good information. We've started the process, not yet completed it. There's a good chunk of folks in there. We have started the process, but lack pieces to complete. So the answer, or the question to ask there, is what are these pieces, and then how can we figure out a way to help them pass that? And alas, 43%, of course, have no formal CRA document. And the CRA document truly is the basis of all community risk reduction efforts. With it, we're sort of just out there swimming with not pointed in any direction. Our CRA document really focuses our efforts based on data-driven decisions and strategies to mitigate risk. So a lot of great information here. We'll look at one more here. Within your organization as a whole, which phrase below would best describe the knowledge and understanding of community risk reduction that you have? So when we look at this, the highest here was a moderate level of knowledge and understanding, which is good. We have 13% that are high or exceptional levels. We also have, closer to 50% with little or very basic knowledge and understanding. So again, this provides us a way to look at this and sort of teach to the middle, as we would say, and bring those folks at the lower end, the 50% on the lower end, to the middle of the pack here, where we would see that moderate level raised substantially. So that would be a goal and focus, moving forward. So we're going to pivot here a little bit and talk a little bit about model performance, evaluation, methodology, really looking at those 4 different measurements of formative process, impact, and outcome. The Symposium was really developed with a specific goal in mind, and that is to fill the gap to identifying peer-reviewed programming that is based in research and data. So what we can find by incorporating these evaluation measures into your CRR planning will result in you developing programs that have a very strong focus and are data-driven. These processes are typically well-defined and have income or impact and outcome measurements built right in. So do they ensure our success in everything we do? The short answer to that is no. But it really helps us learn from our past mistakes. These processes are cyclical, specifically when we're looking at the process evaluation and the things that we do with that. It really helps us understand where we've made a mistake. It doesn't mean that we can't change it and go back. That's what the process is all about, understanding each and every step that we're making, and as well as figuring out a way to fix it and then move forward. One thing you'll find is the Symposium differs from many of the conferences out there It's really based on the peer review process. While others do have review teams that look at presentations, they're not really based on this rigorous evaluation methodology that we have. But later in the presentation, we'll discuss that peer review in greater detail and look at ways to get your program recognized. One thing that I did want to add here is you can always go to strategicfire.org website and IFSTA Resource 1 for more information on evaluation measurement. There are guides out there on our website. There's also classes on evaluation at IFSTA Resource 1. So let's take a little peek here at each one of these. So formative measures here really answers the why. Why are we doing these things? And it describes the planning and research that went into understanding the problem. It helps us to understand and narrow or focus our efforts. When we look at some of these program methodologies, it helps us to reduce things into manageable sort of goals. If we looked at reducing fire fatalities, right, we can look at that one way. We could say, hey, we want to prevent all fire fatalities. Typically, the scope of that is so big that you're not going to be successful. But if we made this into a more of a smart objective here, reducing fire fatalities by XX% in X years, I mean, that gives us something that's time-based and something that we can move forward to be more successful there. We utilize incident data and demographics within the community that demonstrate that link between the problem, that problem statement, and the proposed solution. This is really data-driven decision-making at its best. And one thing we could say that this should not just be used for prevention. This should be used for risk mitigation or integrated risk management through all disciplines of the fire service. When we started Vision 2020 project, we were focused. It was a very focused effort on reducing fire loss across the nation. Through some of the changes that we've seen over the years, we just went through a strategic planning process with our steering committee, and the focus was we need to be more holistic in this. And so I think that is truly underscores the effort here. This is something that is entrenched in all disciplines within the fire service, not just fire and life safety education, not just inspections or code enforcement, fire marshal's office, but in operations as well. This is of critical importance. Formative measures really just build those pieces of the puzzle to tell us why we're doing what we're doing. So we move to process, and process there focuses on the how. How are we doing it? Describe and monitor implementation of a program to start to finish. So this is all about those critical integral steps that are just documented along the way. We created a spreadsheet to track this information. We trained or developed a training session to train firefighters or train civilians or something along those lines. It's how a program is managed and really understand what works and what needs improvement. This was the part where I said, this is cyclical. So if we understand through formative and process that we aren't meeting or making headway towards our goals, we need to look back at the formative process, say, is the scope too large? Do we need to narrow things down so we can better understand what the problem is and develop a solution that is directly related to it? It really highlights the steps that are important to your success here. In developing these process measurements and documenting this information, again, it shouldn't be an extra step. It's just a way that we move forward to think about how we accomplish anything when it comes to risk management or mitigation. So we look at now impact measures, and more so the what. What are we doing out there? We identified the other ones, the why and the how with process, but now it's what are we doing? Indicate and measure changes that have occurred throughout program delivery, and this is short-term change. So these are the things that you did. Identify the number of smoke alarms installed, right? The number of home hazards identified through your home safety visit program. That way, when you do that analysis, you can say, hey, listen, we're averaging, 3 or 4 interventions within each of these homes. You're putting a mark on where where you're making progress and tracking that information. Number of environmental changes here. So this is really critical to measure, but to understand that impact measurements don't directly or may not directly reduce risk to people. They may not be they may not work towards the base problem of leading to incident rates and things like that, focused on our outcome that we want to focus on. So, all right. The last one here is really output measures. And this is looking long-term, how well a program has achieved its overall goals long-term. Again, when we have a narrow scope and we're clearly defined with that problem statement, this makes, tracking output measures much easier, I think. One thing that we can find with outcome measures, if we look at that fire fatality one over time, we really can't say, well, this year, we had 19 fire fatalities last year. This year we had none. So we're doing great. And, we're talking long term here. A year does not make a trend. And so this is a focus of probably 3 to 5 years that you're looking at. And we truly understand that some of the presentations that are submitted don't have great outcome evaluations. And it's just due to the time constraints that they had for submission. It may be relatively new, and the 3 pieces of formative, process, and impact were very, very strong. Yet they still don't have outcome. Should not prevent you from thinking about submitting a program that you have very very strong formative, process, and impact measurements in there, but you still lack some of the outcome. We understand that. We'll talk more about that in the peer review process, that short-term issues with outcome measures, are just that. It just takes time to get them done. So we will discuss some of those again moving forward. But what I wanted to do now was to look at some presentations, and we at time of press here, folks, we had Joe Casciotti, who was a battalion chief of community risk reduction or community paramedicine in Harris County, was unable to make it today. They had a line of duty death incident, so he was very much tied up with that. So I had the choice to remove this or not, and I said, no, we're going to keep it in here, and I'm just going to give it my best once over here. So forgive me, but what we really want you to understand here with the peer review process and the things that we're doing is we want to be holistic in how we're approaching this. So we want to have submissions for mobile integrated healthcare, community paramedicine. That is typically around 75 to 80% of the call volumes that most fire departments see in the United States. So it's important for us to recognize some of these issues, and they're relatively new. So I'm going to give it my best once over here. I'm going to stop my video while I'm doing it because I need to read this. But this is truly a great program, and it's our program utilized patient follow-up with an evidence-based time frame to reduce readmission rates in patients discharged from acute care hospitals with a diagnosis of a STEMI event, in layman's term, a heart attack. And what they found was in their formative assessment that the STEMI events readmission rates for their local hospital was 15.8% versus 16% on a national level. Their goal here was to see if they could reduce 30-day readmission rates to 10%. So again, while they're looking at something that's time bound, put a date on it, but they also didn't say we want to reduce it to zero. They want to reduce it by a manageable figure. And how can we do that? So I think this is very well put together from a formative standpoint. The narrow focus for this really helps them. It doesn't look at community paramedicine as a sort of one-stop shop here. It really focused on a single acute issue with medical care. So, this goes again back to their developing of that problem statement. Their data is truly reliable as a direct result of this community paramedicine program. So with that, what they did, the process to get this done, they created a multidisciplinary discovery group, and that comprised the assistant chief of VMS and community paramedic lead for the fire department, the emergency room manager, the case management director, and the cardiac nurse manager for the hospital. So after they met and discussed identifying the patient population and preferred interventions that they wanted to use, the program was presented to the cardiology physicians for information and feedback as to the benefits and feasibility of the program as they saw it. So they created this multidiscipline group. They basically created the program and then utilized these people to sort of scour through that to make sure the interventions that they wanted to make were going to benefit these people. The process took about 3 months to identify, and obviously with medical and HIPAA laws and things like that, the case managers would send a secure email to the community paramedic lead with referral information for the patient. To protect the patient health information, case managers presented the program to the patient to obtain permission before the referral. So, this is a great recognition of you come up against something that you think is going to be a roadblock, but there's certainly ways around that. So home visits were ideally set up within 48 hours of discharge. And the evidence-based research showed that the follow-up interventions in this patient population suggested that in-home follow-up within 48 hours post-discharge resulted in the most significant reduction in the 30-day readmission rates. So again, the impact here, it again is a relatively new program. Of the 76 patients referred, those that participated had a 4% readmission rate compared to 12% of non-participants. So what they saw was this whole group of people, this whole group of 76 did have a lower readmission rate than their average. However, the people that participated in this mobile integrated healthcare program did have a substantial reduction in the readmission rate. So the one thing that on the impact side, the hospital savings averaged $10,000 per patient not readmitted. So that was a important thing as well. This is a great example. And again, that's why I didn't want to take this out. There really isn't truly a lot of outcome data here. I know Joe has some additional new information, and some of the other presenters as well have some new information that they'll talk to as they present moving forward. But one thing that they did do is identify methods to increase participation through the cardiologist buy-in and recommended post-discharge care. So there were some, some additional things that came out of that from a qualitative standpoint, or both quantitative and qualitative standpoint. And I think moving forward, there's a lot of promise here, and we'll continue to follow this one. So I just wanted to share that one with you. I'm going to restart my video now because I don't have to read. But next on my list is Josh Fulbright, Chief of Community Risk Reduction in the South Carolina State Fire Office of the State Fire Marshal. And Josh will be presenting on FireSafe South Carolina, statewide support for station-based community risk reduction program. So welcome, Josh.
Thanks, Steve. Good to be here with everybody. So during the 2020 Symposium 6, we presented on FireSafe South Carolina and really a statewide support for station-based community risk reduction programming. So getting started here with our our formative evaluation, and really our planning and research and what we did to start the FireSafe South Carolina program. We recognize that we are consistently, since the 1980s, have been in the top 10 of states for fire fatalities. And that's definitely a number and definitely a place we don't want to be. And so we recognized we had a strong history of fire prevention statewide going back to the 70s and 80s. And frankly, we realized that since the 80s, there was a lot of things that we had just talked about and not actually put a lot of action behind. And so in 2011, we started our CRR team on a state level with 3 personnel. Moving to 2020, at the time of the symposium, we had 8 personnel, and now we actually have 9. And we really had a strong emphasis statewide on fire fatality research, being our CLEAR team, our Community Loss Education and Response team. And we actually presented during the 2018 symposium on the CLEAR team. We saw that we had a number of barriers to adoption of statewide CRR programming and support from a state level. And that was, frankly, a number of unity challenges, circling around change in the fire service, staffing, volunteer fire service, time, finances, poor data, training, relationships were just a number of things that were being barriers to us. Looking at our process and what we did in regards to a number of challenges that we had recognized. So what we did as a state's fire service, first and foremost, we need to be united. And so between our office, the State Fire Marshal's office, our state firefighters, our state fire chiefs, and our state fire marshals, we knew that we all needed to be on the same page. And so during the symposium, I showed a video that our governor got together with the leadership of those associations and compiled a video around FireSafe South Carolina, our statewide program. We developed a logo, and we launched the program in the summer of 2017. We developed a mission statement. We developed goals, encircled around injury reduction, consistent messaging, data quality, and promotion of valuable resources. And 4 buzzwords kind of came out of that program, and that was unite, engage, and support and serve. We wanted to be united so we could engage valuable resources and support mechanisms for our state's fire service, so we could support them in service to their citizens. Out of that, we went county by county across our state, 46 counties in the state of South Carolina, and we really focused on how we could meet their needs. We gave them an overview of the FireSafe South Carolina program, provided them some partners who they could initially engage with, and we provided them a community risk assessment, which we had done on a state level. We provided them their county risk assessment so they could start some of their localized risk reduction efforts. We provided some core 4 messaging, which you see there, the reference to that on your screen. And those messages was right alarm, right location, fire drill plans and prep, fire sprinklers save lives, and see a problem, take action. We figured through our fire fatality research that these 4 things alone could help us immediately reduce the impact and loss of fire in our state. From there, we established some goals for our departments who are willing to work with us on a local level. And initially, we saw 76, or right at 11% of our departments statewide come on immediately. Thankfully, this year, we've seen even more. And then earlier this year, after the symposium, we actually recognized our first 57 Fire Safe South Carolina designees, which was just over 10% of our state's fire service. So we were really happy about that. The goals that we asked them to strive towards focused on data practices, engaging partnerships on a local level, engaging their community, and really looking at training amongst their fire service in their departments. We realized there was a gap in the consistent educational messages in our fire service. On an ongoing basis in the future, we're going to look at continuing to set goals and recognizing our fire department's achievements in the coming years. And further into our impact, the really big thing that we've noticed in the short term, so our impact, what we've seen in the short term, have been partnerships. And during the symposium, we recognized a number of partnerships that we've seen from national organizations to statewide organizations in our state. We saw a 40% increase in our training amongst our fire and life safety educators. We've had distribution of alarms to over 132. That number is well over 150 now. Fire departments across our state, and from calendar year to calendar year, we saw a 103% increase. We documented 76 lives saved and a number of partnerships, but we were very happy and proud to announce that we were averaging roughly 20,000 smoke alarms, CO alarms, and HOH alarms being installed in our state every year, with South Carolina being recognized as the #1 state in the country for documented alarm installs by the American Red Cross. We saw over 300 participants at our statewide symposiums, and we saw a really marked increase in our annual inference reporting and a decrease in our invalid rates. And so these were all numbers that we were very proud of on a state level. But one thing that we definitely wanted to capitalize on was the motivation by our state's fire service to produce and promote consistent educational messaging and get smoke alarms installed. And so one thing that we showcased during the Symposium 6 was that from 1989 to 2019, we've actually seen a 60% reduction in the number of fatal fires. And while we've got a long way to go, we were able to say that these partnerships were definitely helping us as the state's fire service. And we've looked forward to continuing to be not only a resource for our state's fire service here, but to other states across the country as Vision 2020 and others support the CEF, the statewide collaboration engagement framework. We definitely want to be a resource and appreciate the opportunity to share here today and look forward to being a resource to others who are preparing similar symposium presentations.
Thank you, Josh. We really appreciate that. You know, this is truly a great effort within the state of South Carolina, and how fast you folks have moved forward there. You are truly you know, sort of a model out there, and we're encouraged about you know, your participation in the CEF and being part of that peer network there. So next on my list here is Mark Griffioen. And Mark is Deputy Fire Chief for Surrey Fire Service in Surrey, British Columbia. And that Surrey, British Columbia will actually be the site of the International Symposium in September of 2021. And Mark is here today to talk about the Distressed Properties Initiative. So welcome, Mark.
Thanks, Steve. Welcome, everyone, and greetings from Canada. So starting with formative evaluation, going back to 2013, we observed here in the city that there was a steadily growing number of vacant or abandoned homes that were being damaged by fire. As property values here in the Lower Mainland have doubled in the past 10 years, many owners became disinterested in investing their properties in order to rent them out. They were content to just let them sit in disrepair while they watched their value increase year over year. At the same time, the widening gap here between property values and income has resulted in an affordable housing crisis and an increase in homelessness and unauthorized occupancy of vacant homes. We held a series of academic studies and workshops to consider the problem, and this led to the conclusion that abandoned property fires are preventable if structures are properly secured or if they're removed. So how do we manage that? For process evaluation, we designed a distressed properties model to ensure ultimately that owners make their vacant properties secure. We identified the appropriate authority under the provincial fire code and the city bylaws that were already in place. We identified that there were some limitations in the community charter which protected the rights of property owners. And we confirmed that we had the ability to recover any costs that we incurred on behalf of property owners under a city bylaw. And we developed standards for security measures along with a list of preferred contractors to assist property owners. We identified data recording and processing methods so we could manage and measure what we did. And we also produced operational guidelines for staff to guide safety, decision-making, and ultimately their actions. So impact evaluation, what did this look like? After we implemented this new model in 2018, we started to observe patterns. We analyzed the first 400 properties that we actioned, and we discovered that there was several primary risk indicators that were commonly present at abandoned properties. And we were able to gather this data and analyze it from sources within the city. So we had access and we owned this data. We were able to determine the age of the building. So the older the building, the more likely it was to be a problem. We noticed that if the building had a low structure value compared to the property, so the percentage of gross improvements was low, that was a concern. And if there was neighborhood development pending in the area, that certainly added to the risk. We identified and captured a value of fire risk by overlaying these components and associating them with proximity to known homeless activity in the area, which we obtained from our bylaws enforcement teams. In order to locate these properties and treat them proactively, we used low water consumption from engineering as an indicator of abandonment. We also discovered that simply requiring owners to board up and fence their properties as we originally intended left many of them still susceptible to break-ins. And we saw that owners were content to allow this condition to continue. We would repeatedly order them to make repairs, but that was a small, very small cost in relation to the escalating property values year over year. So in response to that concern, we developed a new progressive model where each consecutive break-in at a property would result in an order for additional security measures, including an installation of a camera system and then hourly or even continuous patrols by licensed guards. We realized that the only way to eliminate the risk of fire at these properties was to provide encouragement for the owner to remove the structure altogether. So in February, when I presented, we had not yet implemented the progressive security model. And so some of the numbers that you're seeing on the slideshow, I'm going to update them for you now. We have now actioned 700 properties up to date, and 400 of them have been demolished. Right now, there's 200 properties that are secured at various levels to city standards, and 50 of these total homes have been reinvested, and so they're now low-income housing. And 30% of these total properties are under active orders to remedy conditions at any given time. What's the outcome of our program? At this point, we've had 2 fires this year. That's a reduction from a high of 32 in 2016. In 2019, we had 12. So we've had quite a substantial reduction. And we believe that we can confidently say that we have prevented many fires that would have otherwise have occurred in the last 3 years. In addition to reduced exposure to injury and occupational illness for firefighters, the elimination of distressed properties has also reduced calls for service from ambulance, police, and bylaws. Property values have been preserved in neighborhoods which no longer contain distressed properties, and community health and safety is enhanced. Finally, the community property safety team, along with tens of thousands of annual smoke alarm checks, has reduced the rate of fire in Surrey to 0.5 per 1,000 residences. Thanks for letting me share this. I'm happy to answer any questions and look forward to seeing some of you in September.
Thank you, Mark. Appreciate that. Obviously, this is one that really is focused on the code enforcement side, and I think it's important to showcase this sort of diverse group of folks that we brought today to look at that. And next on my list is Karla Klas. And Karla is the managing director of the injury prevention and community outreach for the University of Michigan Trauma Burn Center. And she will be presenting on using outcome data to create, sustain, and expand a community-based injury prevention program. So welcome, Karla.
Hello, everyone. It's a pleasure to be here. I'm so looking forward to when we can gather in person again. So I've been tasked with describing an over 20-year-old program and process in 5 minutes. So I'm preparing you to hold on to your seats because we're blasting off for a ride here, a fast one. So 20 years ago, we saw a 17% increase in our pediatric burn admissions to our hospital burn center. And we started diving in as part of our formative evaluation to look at what was going on with us and what was happening. And what we found is the majority of these involved kids who were misusing fires, or in other words, youth fire setting. And what was really interesting as we dug down a little bit deeper into it is not only was it related to the fire misuse, but several of these kids, these were repeat injuries. So they had actually been burn injured before from playing and misusing fire. And so we dug in even farther then and said, why is this going on? And more importantly, what can we do to stop it? And we learned through this process that from the existing data and from other sources that, if there isn't any youth fire setting intervention provided and or only punishment is used, the behavior will continue. And so we built our program on this foundation, and we also very quickly realized that we can't do this alone. And so we reached out to our community partners, different agencies with law enforcement, fire service, social services, and all of that, and came together and said that we really needed a multi-agency and multidisciplinary approach to this issue that was based on what the evidence shows and what our current best practice is for intervening with youth fire setting. So that established our youth fire setting program, which has been, as I mentioned, has been in existence now for over 20 years. It's a one-day course, and as part of the program, we built in key evaluation points. We do an assessment or information before the course. We do an immediate post-course evaluation. And then we also do follow-up at 1 month and 6 months out. And I mention that because as you're thinking about how you're going to build your evaluation component, you need to be thoughtful about what it is actually that what are your goals and what are you trying to do with this? We absolutely have to do gather as part of our process evaluation, some information on just, how did the attendees, what did they think about this program? Was it helpful? What ideas do they have for improving it? But it's not enough just to have people like our program, and it's also not enough just that there's been an increase in knowledge. What we really are trying to drive here is behavior change. Are we successful in getting these youth to not misuse fire going forward? And so that is a key part of our evaluation with this. So fast forward to 2020 this year, and in building part of our impact and outcome evaluation, we have now held over 119 classes and have served over 2,300 youth and family. I mentioned that we wanted to very much understand, are we actually stopping fire and misuse behavior? And so we did a formal 2-year prospective research study on this, and we found that the youth that went through our program had less than 1% recidivism versus those youth who didn't go through the program and just, did kind of whatever, either the parents got no help or they went through juvenile justice or other things. There was a 36% recidivism rate. So our program very successfully showed long-term that it works and we can stop the fire misuse behavior from happening. And that recidivism rate has remained stable over the years and is still around 1% currently. We also saw that our pediatric burn admission rates went down by 13%, which is an awesome thing, and that our number is now down to only about 7% of these are related to fire misuse. So we've definitely have seen a great change with that. And then I just want to share with you guys in the last few seconds here that we have of that to think about data being your friends. I know I sound crazy. You know, data is technically a plural word. So data are your friends. They really are. And what we found with our program is because we took the evaluation and data collection component of that so seriously, it actually really helped us, not just in terms of showing outcomes internally within our own organization and to the community, but it has led to further program expansion. It's led to significant grant monies, and it also allowed us to be able to, through a FEMA assistant firefighter grant, to build kind of an outreach of it called Sean's Story Toolkit. And that aspect of this program alone is in every state in the United States and is in over 40 countries globally. So what you do and how you measure it really can make a huge difference. And I'm happy to answer questions as part of the Q&A at the end. Thank you.
Thank you, Karla. We really appreciate that. You know, again, this one shows an incredible piece of outcome data that's associated with the program. It's been in existence for 20 years, so we would certainly expect, you know, those types of things to come out from an outcome perspective when we looked at a program that has been in existence for that long. So again, I encourage everybody, if you have questions for any of the presenters, please ask them through the Q&A feature at the bottom of your screen. But I'm going to move on next to Kim Stouse. Kim is the Community Relations Education Specialist at Pocatello Fire Department, Bannock County Ambulance in Pocatello, Idaho. And she is presenting on EMS success, collaborating with assisted living facilities. So welcome, Kim.
Hi, thank you. Good afternoon, everybody. I'm excited to be here. I am happy to share any information that I have. And afterwards, if you want me to send you anything, I'm happy to do so as well. When we started our process back in 2015, we were looking at our calls for service data. My chief is very big on data, which I love. Sometimes you hate it, but it does, as Karla mentioned, it does help you. And what we saw was we were seeing that approximately over about 10% of all of our EMS calls and total fire calls, I guess that includes both, were to our residential assisted living facilities. And when we dove into it a little bit deeper, we found out that of those 10% of the calls, nearly 50% were non-emergent or non-transport. And being that we only have about 3 ambulances that are able to cover an entire county at any given time, we had to come up with a plan on how to address this, given the fact that the patients were paying the assisted living facilities to help them. And a lot of these calls were for mere lift assists, or a patient had fallen and they were wanting us to come out and medically clear them so that the burden would be off of them and put onto us. And so when we got to talking, the chief, we really had 2 avenues we could go down. We could start charging a show up fee, or we could try to take a more proactive approach and work with these facilities. So the chief and I went out and met with each of our residential assisted living facilities. We provided an individual report card to each of these facilities, showing them how many times we've been out at their facility, kind of a breakdown on the calls and what their like emergent versus non-emergent, transport versus non-transport was. And I would say that was a huge key factor in helping to get all these partners to the table. Because oftentimes when we called to make these appointments, what we heard from them was, oh, well, we'll meet with you, but we're not part of the problem. And then when we got to their facility and we handed them a report card based on their facility, it really changed their mindset, and the buy-in was dramatically different. I mean, immediately they're like, oh, I didn't realize that, we had that many calls, or I didn't realize we were calling you so much. And so what we asked of them is we said, we want to put together a group to meet and come up with some protocols as to when it's appropriate to call 911 and when it's appropriate for you to have your nurse or your CNAs tend to the patient that you're being paid to care for. And so we went out to each of the facilities and then developed a committee of 26 members. And that included the residential assisted living facility administrators, nurses, the area of agencies ombudsman, so kind of like a patient advocate. We included our medical director, the state licensing rep for the assisted living facilities, some of our paramedics, and our senior staff. And we worked together to come up with protocols that we would all agree upon. It took about 15 months total from start to finish. And then once we got all those done, sent them out to the facilities for review, excuse me, and had them all review on it and sign a buy-in letter stating that, okay, we agree with this. We showed them documentation that the state licensing was okay with it, that our medical director was okay with it. And then we offered to come out and train all the assisted living facilities. So we went out and worked with each of those. As you see there on the formative, we used the data. The process was we worked together to develop that team, drafted our protocols. And what was really interesting on part of our impact was even just after our initial meetings with these residential assisted living facilities, we started to see a slight decline. And that showed to us that there was more buy-in and that they realized there was a problem and that they were willing to step up to the plate and work with us. So again, after we got these protocols in place, we offered to come out and do the training for free. We went out, we trained their staff, and there was about 12 assisted living facilities and 80 staff members that actually took part of the training. Since then, there's been a few more. But we got them all trained on the protocols, answered any questions. Some of the facilities at first were a little bit reluctant, but when we told them it was for free and they knew that this was going to help them in the long run, they too would buy in. And once we got everybody trained up on it, we got them in place and we started seeing the calls decline. On our outcome, we looked at the call volume at the 2019 mark, and then I just pulled the data for 2020. At our highest year, the calls to residential assisted living facilities accounted for 11.2% in 2013. In 2009, it was down to 4.9%. And as of 2020, it was down to 4.4%. So we're still seeing a steady decline. The no transport rate was its highest in 2014 with about a 50% decline, or sorry, 50% no transport. And then in 2019, it had declined to 22%. 2020 was about 24%. So we saw a slight uptake on that. And 2020 numbers, I'm a little reserved to use those just because with COVID, there's questions as to whether they were nervous to call us or whether they just wanted us to transport them to get them out of their facility. So I know 2020 numbers may not be the best numbers to look at, but it's still showing that we're moving in the right direction. One thing to keep in mind, and it's been a continual process, is, and I'm sure most people are aware, residential assisted living facilities have high turnover. So it's a matter of continuing to offer that training. We also, at the 1 year mark, after the protocols had been in place, we called a meeting with all the administrators and nurses, brought them together at our city council chambers, bought them lunch, and we reviewed the numbers with them and were able to answer any questions that they had. We really wanted to make sure that the protocols were a living document. So if things came up that they found as a problem or we found out as a problem, that we could work together as a collaborative effort and work to get those to work for all parties. I would say it's been hugely successful. The assisted living facilities are happy because they now feel empowered to be able to handle some things that in the past they may have thought they couldn't handle. And our medics are happy because we're not going to assisted living facilities to provide lift assists when we have other calls for service, maybe that are higher priority, would need our attention. But the key takeaways, if I could tell anybody, if you're looking to do this, having your data, looking at the data to see what is going on in your area. Just because that's what's happening in our area, yours could be similar, maybe it's slightly different, maybe it's another area you need to focus on. But having that data, going out and getting buy-in from each of your partners, because by providing those report cards to each and every one of them, that really sold it home for us and was able to get them to come to the table and making them have a seat at the table so that they felt like they were a valuable member and had input and could give feedback as to what they thought would work or maybe that they had concerns about, and working together as a collaborative effort. I know we only have about 5 minutes, so I wanted to make sure I got all that covered. If you do have any questions at the end, I'm more than happy to answer them. I'm also happy to share any of the protocols that we have or the report cards that we used for our facilities, if anybody thinks that that could be beneficial. Did I stay within it, Steve, for 5?
You knocked it out of the park, Kim.
Okay.
Thank you. You know, when I read through these presentations, I really love this presentation by Kim. It truly shows that there are 2 ways to solve a problem, and she touched on that. We could have went out and looked at charging a fee, or we could get ahead of the problem and focus on those CRR characteristics that we talk so much about: being proactive, community partnerships, in this case with assisted living facilities and others on this team to develop these different protocols, being data driven, as well as being cost effective and efficient. So, you know, this program doesn't cost tens of thousands of dollars it doesn't have tens of thousands of dollars of cost, but it provides an extreme benefit that is directly related to the safety, not only the safety of the community, but you know, they're not putting ambulances on the road to go to these facilities. They're saving firefighters' backs from lifting calls and whatnot. So there is a lot of good here, and I just wanted to mention that that I really love this presentation. So let me move forward. But again, before I do, if you have questions and questions you'd like answered, please utilize that Q&A button on the bottom. I'm going to move forward here. We're coming to the top of the hour. I wanted to say a big thank you to AFG. Funding support for Symposium 6 was provided through DHS FEMA's grant program, Directorate for Assistance to Firefighters grant, specifically the Fire Prevention and Safety grants. All Vision 2020 materials are available free through our website or partner websites. If you're looking for training or guides or materials, you can visit strategicfire.org, as well as go to IFSTA Resource One website for that training. So we are going to move forward here to talk a little bit about Symposium 7. It is on the books, as you can see in the upper right-hand corner, coming soon. It will be back in Murfreesboro, Tennessee in February of 2022. We have the dates. We're working on the contract there with Embassy Suites. We just love the venue and feel that this will be an incredible opportunity to get back there to talk about community risk reduction and model performance. So getting your program recognized, what do you need to do? And more specifically, how can we help? We want you to be a part of the premier event for CRR in the nation. These presenters, the ones that came before them, I think can attest that it's just an incredible honor to be on that stage presenting on something that you've worked so hard for, and how it is impacting your community in a positive way. So ways we're going to do that: coming up in January of 2021, on the 12th, we are going to have the call for presentations open for Symposium 7. In that, we'd like you to know that we will host another webinar that we have Monica Colby, who heads up that peer review team. She will be here talking about that process and how we can help our folks move forward. It has been updated. We're making it easier for people to submit their documentation, easier for peer reviewers to review that. But the biggest thing I wanted to add here, we have incorporated a new peer coaching team. This is something that I think really will make us stand out from the rest of the world when it comes to looking at model programs and looking at getting the best presentations. We want to coach you up and answer any questions you have before that process, before you submit, and even after. So when you submit your presentation and it gets reviewed, if you would benefit from having a peer coach to talk about how to go about with your presentation. If you're not If you're someone that's not comfortable being on a stage in front of 350 people, we are going to talk to you on how to get better at doing that as well. So we are very excited about this peer coaching team and what it means to Symposium 7. I can tell you this, that some of those peer coaches are considered the movers and shakers. They know more about CRR than most people in the United States. So we're excited about that as we quickly approach the January 12th timeframe for opening for the call of presentations. So with that, I'd like to say thank you, number one, to everybody that came today to spend time with us. I'd like to thank our presenters as well, and open this up to some Q&A for our folks here. In the meantime, again, if you want to stay in touch, you can always text Strategic Fire to 22828, and that will get you on our mailing list to get all the latest and greatest information. We do have a ton of information coming out here. We have the webinar on the model performance peer review process coming in January. We're also having a SEF webinar, the State Collaboration and Engagement Framework. If you don't know what it is, take time, spend an hour with us and learn how you can help move the needle for CRR in your state. It's a very simple process, well documented, and currently we are in discussions with 23 states in the nation, and we hope to move that number to closer to 40 before we hit Symposium 7. So I'm going to look at the questions here. So here's one for Kim. What issues did you encounter using such a large 26-member community?
So, we had what we did is we would move our meetings from the different facilities. So it wasn't always at one place. And oftentimes they were very eager to host us at the different assisted living facilities or here at our training station. And not everybody could make every meeting. So what we did was we made sure we took good notes and made sure we did a recap and sent it out to all the different people that were on the board in the event that they couldn't make it, just so that everybody could stay apprised of what was going on. But given the fact that it was such a large board, we wanted to make sure that we kept everybody up to date.
Okay. I think this one is meant for Mark. Who is a spearhead behind that? And I think it's incredible you guys were able to work together to implement that program with distressed housing. Are you there, Mark?
I am there. So thank you. The spearhead, I have to say, came from the past fire chief, Len Garris, who is part of the Vision 2020 planning team for the International Symposium. He's no stranger to the use of data, and we have to thank him for really 15 years of solid data collection in the fire service here in Surrey. And so this presentation was basically easy for me to provide because it actually is the similar model to what was utilized in order to develop the distressed properties model. There was a second part to that question, Steve. What was that?
Let's see. I think it's incredible you guys were. Who was a spearhead behind that was the question.
Right. Yeah. So when I was promoted 3 years ago, I was given the research and the idea, the supporting material on the model, and basically was told, make it happen. So it was a gift for me because it was very well developed, well researched, well designed, well thought out. And basically the challenge for me was to continue to utilize data in the most effective way possible, rather than just start a program and see where it goes. And that's been quite valuable because we were able to tweak it in the last year and kind of go through a glass ceiling that we encountered with our original design process, where we were still having one fire every month. But this requirement for progressive security really broke that, because if someone gets to the point where we require them to have continuous security, it's costing them $32,000 a month. So you can imagine that's a pretty good incentive to demolish. And once we have an empty lot, the fire risk is zero. And that's really what's knocked this program out of the park in terms of success.
So
Thank you.
Mark, I just want to see if you can expand on this. So Chief Garris obviously had an exceptional reputation for getting people involved, specifically with data. Can you tell us a little bit about how he engaged academia there in Surrey to bring their level of knowledge, expertise, and sort of energy into these processes, not only with this distressed properties, but really everything that Surrey is focused on?
Certainly. Chief Garris had an interesting background from the perspective of the fire service in that he is educated as a criminologist, and he brought that lens to the fire service and started associating links between criminality and fire risk, and was able to adapt some of the practices that are common and have been common for a long time in law enforcement and bring them into the fire service. For example, we've employed a full-time analyst for almost a decade in fire, and I don't know that there were many others in Canada, any other departments that had a full-time fire analyst. And the attempt there was to do the same kind of prediction and identification of risk and management of metrics and desired outcomes at a statistical level. And so his association with criminology involved his professorship with the local university here. And that in turn led to associations with other professors and academics who were able to provide insight, assist with publication of studies, identify new directions. And we have more than a dozen programs like the distressed properties model that have all been similarly developed and have successful outcomes in the same manner.
So I had a couple left here. Number one, Karla just received kudos from everyone. No questions, but fantastic job. Thanks, Karla. Love your energy, and we truly do. So with that, I have another one for Kim. Kim, how many people on your team are working on this, and what benefits did you sell to the facilities to get their buy-in?
So when we went out to the facilities from our department, when we were creating the protocols, we would have a couple paramedics. We had our senior staff. So our chief actually came to most of the meetings. And then I was there from our prevention bureau. And then how we sold it to them is we explained to them that, we have 3 frontline ambulances and we only have this many resources to cover. If your mom or your dad was having a heart attack, how would you feel if we were to say, sorry, we'll have somebody come, but they're doing a lift assist? And again, provided them with the data from their facility and ultimately said, we're trying to take a proactive approach. Our goal is to do this first. And if we can't get buy-in from this, and if this doesn't work, the alternative is going to be, we're going to have to start charging a show-up fee because you are receiving compensation to care for this patient. And essentially what it comes down to is they weren't wanting to bring their nurse in because most, in our state at least, the nurse only has to visit the facility once every 30 days, but has to be available by phone. And so it was an easy way for them not to have to pay to have their nurse come in and have our staff medically clear their resident. And so we basically told them, we're trying to be proactive and trying to do this as a community. And they saw what we were talking about, and we really didn't meet much resistance after we gave them that report card.
Okay, I have a couple more, and they are truly geared towards Kim here. So I have a lot of questions for Kim. Can we get her contact info? I can answer that. We will certainly send her info to you. So that's Jen, and we will make sure that we put you in touch. And then Kim, there's another one. Is there a way we can get a specific list of your protocols so we have a starting point on things we can suggest if we were able to go this route?
Absolutely. Steve, you have my email address. Anybody who emails me, I will email you a copy of the protocols that we use here in Idaho. And ironically enough, we've had several other communities in Idaho use those same ones because we know that they meet our state licensing. And so absolutely don't reinvent the wheel. I'm happy to share anything that I have. I can send you the protocols. I can send you the report card that we went out to the facilities with, or anything else, or even the training that I went out to, that I do with the facilities to train their staff.
Okay, here's one, says, this is one to us. Steve and Karla, you might want to mention the new youth fire setting prevention module debuting here in, it should be mid-February when that drops. And I'll talk about when it's going to happen. I'll let Karla talk about the specifics of it, but that should be available here around February 15th. It'll be on the IFSTA Resource One Moodle website. Again, this is a free course. It is a youth fire setting introductory course, and I'm going to let Karla sort of expand on that.
Yes, thank you, Steve. So with Vision 2020 and with IFSTA, as Steve mentioned, they're doing an e-learning, so an online course on youth fire setting prevention and intervention. And while it's relevant to everyone, but the real specific goal of it or purpose is to really try to bring about more awareness on this issue and to get people, and I mean public, but also our own colleagues and professionals to realize that we can't just sweep this under the rug, that it really does require a proper and appropriate intervention to stop the behavior. And so it's targeting people that may not have, especially fire service personnel who may not even be familiar with the issue, or of that mindset that, oh my gosh, those kids are just like trouble and I did it too, and we don't need to do anything because we have to shift that culture change. And I will say that that's been an ongoing issue with my own program, even though we've had great success in reducing youth fire misuse. That's only if we get them. And our biggest problem is getting the public and even ourselves, we're our own worst enemies sometimes, colleagues, to say that we need to direct this child to an appropriate program and have the intervention done. And that's been one of the biggest barriers to our program is, as Kim mentioned, as agencies have high turnover rates and staff leave, you have to keep re-educating on what your program and your community risk reduction goals are. But keep it up, and I encourage anyone, if you're even thinking about trying to do, if you have a program that you're excited about or an initiative that you're excited about, submit a proposal. This group is here to help support you and make it a positive thing. It doesn't have to be a big scary thing, and no, you don't have to love public speaking or anything like that to do it. All you have to do is be excited about the great work that you're doing.
That's so true. That's so true. I see Carrie Edward Clemens has her hand raised. Carrie, do you have a question, Chief?
Trying to figure this out. I do not have a question at this time. She answered it. Thank you.
Perfect. Okay. Chief Clemens is the one of our new steering committee members on Vision 2020 steering committee. So we welcome her not only to this event, but to our steering committee as well. So with that, we have come to the end. One thing we will do is put out everybody's contact information. I know there's some of you have questions specifically for each of the presenters, and we will make sure everybody has their contact information to email them with any questions you may have. So with that, I want to say thank you again to all the folks that joined us today. I want to thank you for our presenters who did an absolutely fantastic job, not only with their presentations, but also bringing a lot of insight to the process as well. We look forward to engaging you on more discussions with these additional webinars. That's Symposium 7 call for presentations coming up. But I wanted to end by saying happy holidays to everyone. Please enjoy a safe, wonderful holiday with your friends and families. And I wish you the best. So thank you, and have a great day.